afternoon, everyone. I want to start by thanking our friends at Western University's Center for Research and Education on Violence Against Women and Children, especially Linda Baker, for always ensuring that the voices of women, girls, and gender diverse people with disabilities are at these tables. Thanks also to the Public Health Agency of Canada for the important work and research they have supported, and to all the incredible folks and organizations that have contributed to this conference. I'm sorry I cannot be with all of you in person, but I had a fall last week. I'm on the mend, but not ready for airports and hotel conferences. I'm joining you today from the unceded territory of the Kainai people. How I wish I were here to talk about health promotion in a good way. In Health Canada, we're responsible for ensuring that MAiD and MAiD Track 2 are made available to people living in Canada. Living in Canada is what I said just now. Living in Canada. MAiD is widely understood to be offered to and made available to people who are dying in Canada. But since 2021, MAiD Track 2 is also the law in Canada, and it's been offered to 1/3 of women in this country simply because they live with a disability. Women with disabilities and gender-based violence, MAiD Track 2 is not a healthcare option, is not what I wanted to talk about today. But 30% of women in Canada live with a disability today. We're a G7 country, and that's the data. That's where we are. For Black and Indigenous women, the rates are even higher. And to be clear, healthcare provision in Canada is the responsibility of the provinces and territories. And so we are not directing this at Health Canada, but we are trying to make everyone aware of the impact of MAiD Track 2 on women with disabilities in Canada. As many of you know, MAiD was intended to provide support to individuals whose deaths were imminent, and many families and people in Canada who have accessed MAiD support this as part of healthcare. MAiD Track 2 data has already begun to show, however, measurable failures in ensuring that people with disabilities are not accessing MAiD Track 2 because we have failed them. If you look at the slide that I'm providing with you, we can see clear evidence that not having access to disability supports and many other issues are leading us to a situation where we have people with disabilities under MAiD Track 2 not accessing MAiD Track 2 for any reason that should be a consideration for ending one's life. Women with disabilities still face the highest rates of gender-based violence, unemployment, poverty, and poor access to healthcare services. And on this slide, as you can see, I'm at a press conference in 2024 with my colleagues because we are taking a charter challenge to the Supreme Court as MAiD Track 2 is unconstitutional and in defiance of our rights as people with disabilities, in contravention to the Convention on the Rights of People with Disabilities as well. So on the very day of this press conference, my colleague pictured here, along with Krista Carr from Inclusion Canada, is the president of the Council of Canadians with Disabilities, Heather Walkus. And at the press conference, Heather described her experience at a recent medical appointment. Heather had a fall while she was transferring from her power chair, and she bruised her hip. She was asked whether or not she was aware of MAiD Track 2 at that medical appointment. So quite clearly, more research is urgently needed to better understand and document what is actually happening to women with disabilities when they seek even basic medical care. Fear is so great that many women with disabilities are reluctant to seek health care. And that can't be the option we're offering them. And it can't be MAiD Track 2. Again here, I'm very pleased to share the most recent publications of Ramona Coelho's piece. This one here is Rushing to Death in Canada's MAiD Regime, an important piece in the Macdonald-Laurier Institute's Inside Policy, April 7th, 2025, where barriers to care persist, but access to MAiD keeps expanding is again the theme of this article. In addition to that, she's also the co-author of another publication with collaborators Trudeau Lemons and Kay Sonu Gained called MAiD in Canada, which provides a deeper dive into the situation in real time. Friends, I have post-it notes on the window sills of my home office where I'm sitting today recording this session for you. The names of some of the many women who have given up hope. These were strong women, leaders who've been lost to us because MAiD somehow seemed less terrible than the complete loss of their dignity, their homes, and their agency. And so, my friends, shelter and outreach partners, when we speak about the need for change, we are speaking to the funders, to the leaders across the country who continue to underfund and under-resource gender-based violence services and solutions. Because we know that women and girls with disabilities experience gender-based violence at 2 to 3 times the rate of non-disabled women, but are not accessing shelters and are not accessing frontline services in the numbers that this would suggest. The vulnerability of women with disabilities forces gender-based violence at rates 2 to 3 times higher. The data shows that many do not seek help. Dawn Canada's Rooting Resilience Initiative is developing a core curriculum and actively working on scaling up the Rooting Resilience Initiative funded through Women and Gender Equality. More on that soon. In addition to that, I'd also like to point to some additional resources on the last 2 slides in my deck, including a number of sources you can look for more data and more information. Dawn Canada and our partners urge our government, our federal, provincial, and territorial governments to make investments in affordable and accessible housing, in healthcare, including mental health services and gender-based violence protections. And above all, we want pathways to leadership and not more pathways to death. On behalf of Dawn Canada and our partners in this work, I want to say a huge thank you again for the opportunity to present on MAiD Track 2. Again, thank you for your time. Miigwech, merci.